In the US, the studies have recently shown that 300 to 400 physicians actually commit suicide every year. For example, when I go and take a handover of an evening shift, only to learn 3 of my very senior doctors have called off sick. So what am I left with? I'm left with junior doctors plus an emergency department full of patients. Engagement is a part of the solution. If you try to continually avoid your work whilst being at work, you are actually feeding in the fire of burnout even more. Hello and welcome. And today I'm going to remind you something about yourself. I'm going to remind you about a passion that you once had, the passion to become a medical professional. Be it a doctor, be it a nurse, or any other profession that you are still involved in the middle of this darn pandemic. But somewhere along the lines, that passion led to a burnout. Now, WHO defines the burnout as a combination of 3 main things. It's in fact categorized now as a syndromes. Number 1, you're always tired and exhausted. No matter how much rest you've had, no matter how much downtime you had, the moment you turn up to work, you feel exhausted. That's the number 1 step, or that's the number 1 symptom rather. Number 2, you're cynical. You're cynical towards your work. The system is not working for you. The things are never going to get better. And you're cynical towards your career. You feel stagnant. You feel that you're stuck in the middle of nowhere and there's no way to progress. And obviously, given those 2 factors, the third factor is that you are non-productive. You're non-efficient and you're sending negative connotations to the junior staff who are working with you. They see you emotionally exhausted, physically exhausted, being cynical towards your workflow, being cynical towards your patient, and you're sending bad vibes to all of them. So you are actually being non-productive and non-efficient. This is a burnout. But my burnout seems to stem from different things. It is often a combination of lack of resources and some personal and professional factors, but it tends to fluctuate. I may have a day in which I'm utterly exhausted at my work. For example, when I go and take a handover of an evening shift, only to learn 3 of my very senior doctors have called off sick. So what am I left with? I'm left with junior doctors plus an emergency department full of patients. The patients who've been brought in by police, been drunk and disorderly, and they need stabilization. The patients who are mental, they're drug-induced, psychotics, and the mental health won't see them up until I'm able to medically clear them, despite the fact they don't need to be medically cleared. There are patients in the emergency department who don't need to be there in the first place. They've been sent by their very anxious GPs just to protect themselves, and I'm there to go and pacify them and tell them there's nothing wrong with them. This is adding to a burden with lack of resources in a system which is not working right now. And then throw that in a mix in the midst of pandemic, when I've still got sick patients coming in, sick pediatric patient, sick adult, young adult patient, and sick elderly patients, which I'm expected to work with all my mind, all my strength to look after them, put them into intensive care unit, or be able to stabilize them and send them home and make them a good management plans for them. This is all an expectation for me during an average shift. And don't get me wrong, it satisfies me. That's what I signed up for. That was my passion. When I do that, I do feel good about it. I'll give you an example from last week. I was working in a very busy department. There were patients who were COVID positive, and I was able to stabilize the patient by doing, advanced procedures on them. There was a patient who was crashing and had no IV access, and I was able to put an intraosseous access, and then the patient's life was saved. And the number of different patients in different needs, sometimes very dire needs, where my intervention has helped them drastically. At least that's what I feel like it. And that helps them. And that brings me into this phase that, yes, I believe in this job. I believe that my work is contributing positively in someone's life. So my burnout is not there. It's actually anything but a burnout. But then throw that in a mix with a different shift in which I'm busy, there's no staff, there are patients who don't need to be in there, and I am stuck dealing with those problems. And that's what causes my burnout. So, what does burnout manifest? Well, in the US, the studies have recently shown that 300 to 400 physicians actually commit suicide every year. And the suicide rate in men is 40% more than in general population in physician men. Similarly, suicide rate in female physicians is 130% more than in general population. So obviously they are burning out, tiring and feeling emotion. Needless to say, they may have an underlying mental health issue. That mental health issue may have been exacerbated by the system which is not working for them, a system which is driven by profit loss, target and deadlines, and this system is completely exhausting them. It's completely burning them out, and they don't feel passionate about providing the medical care that they once thought they will be doing. So what can we do about preventing a burnout? Number one, down and disconnect. You go to your work, you give your 100%, you come home and you disconnect completely. This is a time in which you just completely forget about anything which has happened at work and you engage with your family. You know, the family is that therapeutic index, I call it, which is able to pacify your emotional needs, and they do it in a way which does not even sound like they're doing therapy for you. Just talking to them, just engaging with your children completely pacifies you down. So if you engage with your family, don't think about your work, don't talk about your work, that helps. Number two, find a hobby. Doesn't matter what hobby it is. It might be, making paper planes, a music, a drawing, going out on a long drive, listening to music, anything which is not work related. Find a hobby that really fancies you and is able to, engage you or involve you in a completely different tangent. And that will help you explore your mind and relax your mind in a way that you'd never imagine. I've recently started listening to very old music, which helps me untangle, which makes me happy. And I think that is one of the things which we can try and find our own little niche and the areas of interest, which helps us in the global scheme of things. Number three, talk to someone. If you have got an underlying medical problem, if you do have an underlying mental health issue, be it a mild one, talk to someone. Talk to your partner or wife or husband. Talk to your GP about it. If you've got an underlying medical condition, high blood pressure, diabetes, cholesterol, or whatever it is, please have it settled. You can't have a broken body and a broken soul and then go to work and expect 100% performance. You need to have the organic problems rectified. Mental health is an organic problem. Physical ill health is an organic problem. And if you're not healthy, you won't be able to give you 100% at the job, which is very demanding. And obviously, you feel passionate and caring towards your patient. You need to be looking after yourself first from that point of view. Number four is variety. When I used to work as a registrar, there were a very wide diversity in my workplace practice. I would be given a shift in acute. Sometimes I would be given a shift in subacute area. There would be a shift in pediatrics area. There would be a shift in, short stay area. There might be a shift in which I'm just doing teaching. And I enjoyed that variety. Even though I tend to hate that one shift in particular, like pediatrics, I didn't like it. Sometimes I didn't like short stay. But I think that overall combination, having that diversity, helped me finish 6 to 7 years of my advanced training in emergency medicine. And to the very day when I'm working in emergency department, still, I need to have a variety. There are shifts where I'm working in resus. There are shifts when I'm working in acute area or pediatric area. And that again helps me gauge myself up and down, helps me buckle up or relax back if I'm on a non-clinical shift. I think finding a balance there is something which really helps me try to help me pace myself depending on the various demands of my job. You don't have to be giving your 100% every time, every day of the week, every week of the month, every month of the year. You need to calm yourself down and pace up yourself. Lastly, engage. When you are at work, try be engaged. Even though you may feel like you're tired, you're exhausted, you're down to your 8th cup of coffee, but engaging with your patient and engaging with your team for at least a half an hour, you'll feel that all those negative thoughts just evaporate and you feel more energetic. You feel more productive. So by deliberately pushing yourself to an engagement level will help get rid of the negative thoughts and negative physical connotations. So for instance, you've gone to your work and you're feeling tired, you're exhausted, you're feeling cynical, and you've got all that classic syndrome picture of WHO definition. But engage. Push yourself for at least half an hour to be engaged with your patient, to be engaged with your junior doctors or your colleagues, your nursing colleagues, all of this engagement will give way. You'll feel better when you've met an outcome. Whenever there's a good outcome about a patient management, about a productive discussion, you feel good about yourself. And that good is a part of your well-being. During that shift, engagement is a part of the solution. If you try to continually avoid your work whilst being at work, you're actually feeding in the fire of burnout even more. Think about it. You are what you believe that you are. You're not going to tell yourself that I'm a burnout doctor and I can no longer do this job. If you tell yourself that I can do this job and at least show some initial strength to deal what is the job at hand. If this job involves seeing a patient, go and see the patient. If the job involves even putting in a cannula as a senior doctor, do that. I still do that. If somebody asks me to put a cannula in a patient or do a dressing or hold up a leg for a patient when they're reducing a fracture, I volunteer myself. I think that helps me. It satisfies me that I'm still productive. There are countless people who are not productive. Oh, it's just beyond me. I'm just so senior to do that. Don't think of yourself as that. You're not beyond anyone. You're not senior beyond anyone. You're a part of a big team who are all working together. And I think as an individual member, your strength lies in your engagement. If you try to understand this very last concept easily, you'll make a huge and remarkable achievement in your own. And you can pretty much break off those boundaries of cynicism, lack of productivity, and mental exhaustion immediately. Imagine why you feel so emotionally and physically charged at the brink of exhaustion just after you're finishing up a resuscitation of a cardiac arrest. It's that level of engagement. You get a bad call that 45-year-old patient has been brought into emergency department with a cardiac arrest. You're able to resuscitate the patient and save the patient's life. You feel like you've had 100 cups of coffee, just like that. Please do that and you'll feel a different person. Thank you and look after yourself and take care of each other.